So that's a cappella singing. It's got to be Blackfoot.
Okay, hello, welcome to H3, the show about health, hope, and happiness. My name is Alan Friesen, also known as the Acapellas, also known as Samansky. And we have a guest. Scott is unable to be with us tonight. He is suffering from COVID. But Rachel Hoof is with us here. Hey, Rachel. Okay,
Hi.
great to see you. So Rachel is very much involved with the health and wellness and supporting health and wellness for her Blackfoot brothers and sisters. Tell us more about your role in that, Rachel. What do you do?
Oh, okay. Well, thank you for having me on your show, first of all. And I'll just tell you a little bit about myself and my role as a regional service coordinator for First Nations Health Consortium. That's my current employment. I've been there for a little over 2 years now. And what I do is I help parents submit applications to Jordan's Principle, which is funding that's created for Indigenous children and Inuit children from 0 to 18 years of age. So parents could apply for anything that has to do with their child's health and well-being, being social, educational, health, like medical. So we like to help families apply for things that First Nations Indigenous benefits, FNIHB, First Nations health benefits. That is our what's known as the treaty that, well, not the treaty, but it's one of the treaty rights that Indigenous Canada looks after our health.
Right.
So they don't pay for a whole lot. It's pretty basic health coverage, but they don't want to cover. They don't cover a lot of things. So, for example, like massages, occupational therapy, physiotherapy. What else? Certain medications. So we help fund those health related issues that otherwise parents can't afford, or they just don't know what to ask for. So, say a child has Down syndrome and they need special equipment, we would put together a application based on the healthcare provider's recommendation. And so, say I still call them, well, Indigenous Service Canada won't cover it, but I like to call them Indian Affairs because that's what I've known them for many, many years of my life.
Sure.
Um, the younger generation may know them as ISC, Indigenous Service Canada. They changed their name, but they do the same thing over many, many years. So what I'll do is I'll help put an application together, and a lot of parents, they don't really quite understand the system. So if they run into any roadblocks, that's where I'll step in and help. So we try to have it what we call parent led. We try to empower the parents to ask questions, to go about that. But some parents, they're just maybe intimidated by the system, and so I'll step in and I'll help advocate on behalf of them. Then we get the application together, and then that's basically my role. And then I submit it to Jordan's Principle, which is a department under Indigenous Service Canada. And then we wait for it to be adjudicated. And then once we get the approval, or sometimes right now there's a lot going on right now politically with Indigenous Service Canada and treaty rights, which are impacting the children. That's the sad part
Mhm.
because it's their health that is suffering. So other than health, equipment, medication, we can help with social and education. So I've submitted a lot of applications for tutoring, equine therapy. And right now, with the cost of living being so high, I'm finding more and more parents asking for support with groceries and rent. Normally, we didn't do that the first year, but because resources are just so limited, and especially in Southern Alberta, if you live off reserve, you don't qualify for on reserve support, vice versa. So we just try to make sure the children are not suffering. But unfortunately, like any other system, You got people that are just submitting for anything, and that's really backlogging the system. There's a lot of different factors right now, but we are still getting approvals. And so when that happens, I feel really happy that I'm doing my job,
Yeah.
helping parents access the services that maybe they just aren't really fully aware of, because we're so like if you're born Indigenous, you get a treaty number, you fall under the Indian Act. And so they have basic dental, basic health, and anything over and above that, if they say, no, we don't fund that, then we just take that as a no. Whereas Jordan's principle kind of takes that step further. Well, you can ask for more. You have a right like any other Canadian. We call it a gap in service. So if we can identify that it's a gap in service, then we can apply. So there's like no handbook that says this is what you can apply for. This is the limit. We just ask, and some asks that we've had, I've been quite amazed, got approved. I was just sharing with a coworker this morning. I said, there was a young mom, got her life back together, took some training to become a home care profession, but because she couldn't get the 9 to 5 shifts, Monday to Friday, and she had young children, she applied for a nanny, like to look after her children after hours, like the normal daycare hours, and weekends. And that got approved just to help her get on her feet I think we got approval for 6 months, I believe. And so, so things like that, I'm always kind of amazed at what we can ask for. And it's all for the children. Like, we're here to advocate for the children. That's
Wow.
what I do for my day job in a nutshell. I don't want to take up too much time. I love to go on and on.
Well, that's like your role there as being an advocate, understanding the system, being able to help people navigate, a very complex system, right? And then having that flexibility to get other resources that are going to be the right fit to help that family and those kids. That's amazing.
Yeah.
And Jordan's principle came about because there was a young man, Jordan, who died, right? Because of a lack of getting the services and the supports he needed, right? Is that correct?
Well, that and the provincial, the federal, and the municipality government were all fighting over who was going to pay his bill.
Yeah.
And the provincial government didn't want to release him from the hospital because he would have been released to the reserve, where they felt there wasn't adequate services to keep him alive. And so the federal government wasn't willing to put those services in place for him, because they came from Norway House, a remote community in Manitoba. So while they were fighting over jurisdiction and who was going to pay for what, Jordan River Anderson never got to go home. And because it was so fragile, he ended up living his life in the hospital, in an institution. And so that was tragic. And he was just one of many, many Indigenous children that fall through the cracks.
You bet. Yeah, you bet.
Mm-hmm.
Yeah. So what you're doing, amazingly important. Wow. Huge. So the other thing that you and I wanted to kind of go through is this survey that we chatted about. And basically just a little context about this survey. There's obviously a tie between financial concerns and health, right? If you're in a bad way financially, that impacts your health, right? That's the stress of it, getting the resources you need that if you don't have the money to purchase them, to acquire them, that's huge. So this lovely woman, her name is Gabriella Kirk with Alberta Health Services, created this survey that she has distributed it out to the health network, to the what's it called, all of the doctors together, the clinics together, where they work together, right? And then the idea is, if somebody comes in, a patient comes in, then they say, hey, does your financial situation have a negative impact on your health? And if so, they have this little survey they run through, and then that survey, based on the answers to the question, produces a report that generates to say, hey, here's resources available that might be of value to you. So what I'm thinking that you and I will do is we'll just bring the survey up, and you can answer the questions like as somebody else or whatever you'd like to do, but just to the point to show what questions are asked and what the end result of the survey is. So does that make sense? You good with that?
Yep.
Okay, good. So I will bring this survey up. There we go. Yeah. So here it says reducing the impact of financial strain. And it just identifies that, income is one of the most powerful determinants of health. And so, yeah, that's the word I was trying to say, primary care network for Chinook. And so that's where the caregivers, the doctors, nurses, etc., are trying to coordinate their efforts to provide better, more seamless care for patients. And so this says, what clinic organization are you from? So you notice all the clinics that are listed here, but you do not have to get this through a clinic. You just go on and do it at any time. Have anybody can use this. So here, if I click other and say submit, then it's going to start where it asks me some questions. So do you want me to read these questions, or you want to read them and just tell me what the answer do you want me to give?
Just read them because, okay, I can enlarge the screen a little bit. Okay, so the first question asks what gender you are, female.
Uh-huh.
Okay.
Mm-hmm.
Citizenship, Canadian or permanent resident?
Yeah. Okay. So permanent resident.
Or sorry, citizen. I guess I could say citizen.
Well, what would be the difference? Oh, permanent resident would have been somebody who came from another country, now lives here and has a permanent resident status, right? So
Right.
citizen is if you're born here, you're a citizen. Okay, good. All
Okay.
right.
So I'll make up a fictitious person, and I'll pretend I'm her. So I'll say I'm single.
Okay. Sounds good.
I'm unemployed.
Unemployed. Okay.
Experiencing homelessness.
Experiencing homelessness. Yeah.
I have children under 18. I'm pregnant and expecting. Can you click? Yeah, okay.
Yeah. So just those two, pregnant, expecting, and
And then
children.
let's say recent death of immediate family member.
Yeah, that's a common
Mhm.
theme, isn't it? Okay. And
Education, let's say completed grade 12 GED.
okay.
Okay, Indigenous, living off reserve, First Nation.
Okay. First Nation living off reserve. Okay.
And let's say part Métis. What can you do? Click two of them just to see.
Yep.
Okay.
Yep.
All right.
Sure. Okay.
All right. Do you have any of the following medical issues? I have some physical disability,
Mm-hmm.
mental health, medical equipment. Say I'm diabetic, because those little strips are really expensive.
They are.
Yeah, dental, vision, dietary restrictions. Okay. All right. The next question is, do you have any issues with the following things? Housing, utilities, food, security.
Are you telling me to select all three of those?
Yeah.
Okay. Housing, utilities, food security. Okay.
Let's say underemployed,
Underemployed. Okay.
clothing and items for my children.
Mm-hmm.
Okay. Let's say that.
Okay. And then how old are you?
Well, didn't I say I was pregnant in one of the things? So,
You did.
let's say I'm 28.
28. Okay. And what community do you live in?
Lethbridge.
Lethbridge. Okay. And now this has about if you'd be considered low income, and they have these charts here based on where you live and how many people are in your household. So based on this, would our person that we're doing this for they'd be considered low income?
Less than, yeah.
Yes. Okay. So yes, low income. Have you filed your taxes in the most recent year?
Let's say no.
Okay.
Oh, well, maybe, yeah. Let's say yes.
Let's say yes. Okay.
Yeah.
All right. Are you a vet?
You need to do that to get child tax.
Yes, exactly. If you're
Yeah.
not doing that, and I think that's a problem where a lot of people don't get their taxes filed, and then they lose out on a whole bunch of resources, right? So
Yeah.
yeah.
Okay. Are you a veteran? No.
Okay. All right. Next page. Okay. So here's now where we've done the query. Now it comes up with what's available, right? So from the national resources, we got the GST, HST credit, the climate action incentive payment, the non-insured health benefits for First Nations and Inuit, the Canada Child Benefit, the Canadian Learning Bond, the Canadian Education Savings Grant, the Child and Youth Support Program, the Disability Tax Credit, the Canadian Dental Benefit, EI.
Yeah, I kind of want to look at that one because
Sure.
I get a lot of families, their children aren't registered
Yeah.
and they just automatically come straight to Jordan's Principle. And when I ask the dentist, well, what does AHS cover?
Yeah.
They don't cover a lot. So yeah, I didn't see that one. Okay, yeah, all right. I'll look at that one on my own time.
Okay.
Yeah. Oh, then EI maternity. Okay.
Yeah. And then the EI regular benefits for period of unemployment, Canada Pension Plan, and Jordan's Principle is listed on here, which of course you're the expert in that. You know, one thing that I don't see here that I learned, which you may be familiar with this or not, there's actually a disability savings plan. If you have a child who has challenges, that you can apply and get matching federal money to build up resources in an account, so that when like the parent who is looking after the child passes on or is no longer able to care for that child, they've accumulated some money that can be used to pay for care for that child who's outliving the parents, right? So I just thought about that a couple months ago, and that's like an amazing benefit. So I'm not sure why that was
on. Because we have a lot of Indigenous children who are becoming, like, their parents are passing away and grandparents are raising their grandkids. And some of them, of course, are going to have trauma, emotional trauma.
Definitely.
I wonder if they could qualify for that.
Well, it seems to be, my understanding of it, it's fairly broad based in terms of what qualifies. But actually, we did a little show on it. We did a little show specifically on it where we interviewed people that were very knowledgeable about that program. And like in some cases, they were able to save, because it's a matching type thing, right? And they were able to, no, it's not even matching. It's like, I think the federal government puts in 2 times whatever the person is able to put in. So if they put in 2,000, then the feds put in 4,000, right? And you could do that like every year for like, I forget, 25 years or something. So yeah. Okay, so let's go back to our other little thing. Okay, so Jordan's Principle. Next page. So now we're on provincial resources. So affordable internet. So basically TELUS has a low income internet connectivity, $10 a month. Rogers Connected for Success, internet and cell phone plans for low income peoples. Disability related employment supports. Alberta Adult Health Benefit. Covers health benefits for Albertans and low income households who are pregnant or having high income prescription drug needs. Okay. Alberta Aids Today Living. I'm familiar with that one. Assured income for the severely handicapped. Do you know how much that actually pays? It's like what, $900 a month or something?
It varies because I hear that it's like $1,800 a month.
Oh, is it? Okay.
And maybe, I don't know if it depends, if it changes based on your disability, or I don't know.
Yeah.
But I've heard that, it's at least they can get their rent paid.
Yeah.
But other than that, it's not much more. Like, you have to get through, it's only one monthly payment.
Right. Okay. Emergency financial assistance. So financial assistance for unexpected emergencies available for emergency needs allowance. Okay. Emergency assistance for Alberta's facing utility disconnection. Rent supplements program. Shelters and supportive housing. Subsidized housing directory. Supplementary benefits special diet. Okay. Individuals require special diet for health reasons or provided an allowance to cover the difference between the regulated food rate and the additional cost of the food required for a special diet. All right. Transportation to day or employment programs. Alberta Child and Family Benefit. Alberta Child Health Benefit. Children's school expenses. Assisted living program. First Nations Health Consortium.
That's me.
That's you. Yeah. Alberta Child and Family Benefit, Child Care Subsidy, Family Mediation, Adult Day Support Program, Adult programs are designed for adults who are over the age of 18 who may have physical or mental memory challenges or are living with chronic illness. Okay. Home care services, residential access modification program. So if people needed to, because of mobility issues, put like ramps and such like that in their home, right? So, okay. And then the next page now goes into regional resources. So social benefits advocacy program. I've never heard of that one before. Have you?
Oh, no.
Yeah, me neither. Social benefits can help you with questions and concerns about government assistance programs, services, and support. Interesting. Okay. Counseling, outreach, and education. And Lethbridge Family Services does tons of this. They're a great organization. Elsie's House, temporary housing program to equip pregnant women and new moms with a safe and caring place to call home. All right. I was not familiar with that either. Edenbridge Family Services. Okay. Interfaith Food Bank Society, Lethbridge Food Bank, Home Services, Lethbridge Housing Authority, Lethbridge Pregnancy Care Center, Pro-Choice YQL, Lethbridge Soup Kitchen Association, Money Mentors, My City Cares, and Better Beginnings. Okay. All right. Is there more? Let's look. Kainai Women's Wellness Lodge. Main purpose provides safe and secure environment, crisis intervention, and support to women and children 7 days a week, 24 hours a day. Okay. So that is, and that one's in standoff. So then the next page just basically goes where you submit this, and then you can download that actual survey that was produced so that you have the contact names and the little descriptions of the program so that you can give those a go and see about getting those supports in place. Hey?
Oh, wow.
Yeah. So quite a bit of resources there. Were there some new ones for you there, Rachel?
Yeah. Oh, yeah, for sure. I'm going to share this primary network with my coworkers.
Yeah. Yeah, I think it's great. I think that the more we share it, the better off. Just to kind of, and for that matter, like I'd be glad to just if somebody says, "Oh, I don't have a computer, I don't know how to do this," I'd be glad to just kind of work through it with whomever would want it and print it off.
Did you just search Primary Care Network to get that survey?
Well, no. What I actually did was I got a link from that Gabriella. And that's what I used to do this. Now, of course.
Okay, so say someone just wants to find resources, but I'm sure Primary Care Network has a webpage.
Yeah, if you looked at it, every doctor's office that was on that list, that there was a lot of them, every doctor's office should be familiar with this, right? As a matter of fact, they should be initiating the conversation, right? Is your financial situation causing you, poor health or having an impact on your health? And then go through that survey with you, right? So, because it didn't take as long, like 10 minutes to kind of something like that. I mean, now then you'd have to read and make the phone calls and all that kind of stuff. But still, I think there's some value in that. So I'm pretty sure Scott posted the link for the survey in the show notes and that, so that that's available as well. So, yeah. Okay. So that's basically everything that I wanted to kind of run through, is just show people about that resource and further, like make the offer, like you, Rachel, now that you know what it is, and I'll send you the link, people could contact you and you could walk them through that survey. If people wanted to contact us or me, then like I would gladly walk them through the survey. And if they don't have a printer, print it off and take it to them and put it in their hands so they can call the numbers that are on it, right? So
yeah.
Cool.
Okay.
Anything else that we should discuss?
No, I think I'm good.
Okay.
Thanks for having me. Good seeing you again, Alan.
Thank you, Rachel. I really appreciate you coming in and helping me explain this, and like your wealth of knowledge, that's for sure, especially about Indigenous health resources that are available. So yeah.
Well, thanks.
Yeah.
Okay.
Thanks. Gitamatsin.
Gitamatsin. How do I log off? Oh, I just leave studio. Okay.
Okay. See ya.